If 1/3 of patients can be survived, that is all because of magic of immunotherapy, which has come into picture. Especially melanoma is very chemosensitive, and very few cancers are immunotherapy is so sensitive. Among them, the poster child would be melanoma, where just immunotherapy alone, nothing else, even in stage 4 cancer, is required. Just immunotherapy, but repeatedly for approx 2 years. If patient is able to afford it, out of 3 patients, 1 patient you will see even after 5 years.
And joining us with the important conversation is Dr. Prabhat Bhargava, Professor in Department of Medical Oncology at Tata Memorial Hospital, Mumbai, one of India's leading institution in cancer care and research.
Melanoma, what we see in Indian scenario is way different than what has been described in textbooks. Textbooks most commonly describe melanoma in sun-exposed areas, so where sunbathing is more common. In Indian scenario, sunbathing is not that common. We already are in a warm climate. That is why melanoma is rare, and we have uncommon types of melanoma, which are not directly related to UV exposure, like mucosal melanoma in oral cavity or in the anal canal is very frequently that we see, or in the acral melanoma is very common.
How early diagnosis can completely change the melanoma outcomes, and how different is the treatment journey between early stage and late stage melanoma?
For stage 1, only surgery is required and nothing else. Even then, surgery can be just simple, but a good surgery by a good surgeon is required, and 90% of patients' outcome will never have the cancer back, so nothing else is required. But if it enters into stage 2, then after surgery, 1 year of immunotherapy or some other targeted therapy is also required. And in for stage 3, then immunotherapy has more bigger role, that with surgery alone, less than 50% will get cured. If I add immunotherapy, then yes, again, chances of cure reaches 70% or even beyond. And stage 4, role of surgery decreases and role of targeted therapy or immunotherapy comes into a bigger picture. And once surgery is done, most of the patients feel that surgery is done, that means I have achieved cure. But there are chances of cancer coming back. Whatever was visible to the naked eye, that surgeon has removed. But whatever is invisible, that may be lingering around, and that is the cause that many patients get cancer back. So to remove that, what is not seen, surgeon cannot do that, and that is why we have to give some medicine or the other which will take care and remove the remaining thing.
People with darker skin don't get melanoma, myth or fact?
It's a myth. Everybody can get cancer.
So if a spot is painless, it cannot be dangerous?
No, cancer can be equally be painless in many patients. Cancer pain is the worst pain, and that is why people feel that pain nahi hai to cancer nahi hai. It is not the fact. Cancer can be painless also.
Hello and welcome to another episode of Spot the Sign, a special awareness initiative by Voice of Healthcare, dedicated to building greater awareness and encouraging earlier action against melanoma. This series is focusing around creating more informed and meaningful conversation around melanoma. So, from recognizing early warning signs and understanding the risk factors of addressing the real challenge around diagnosis and treatment in India. So, one important reality that has experts continue to highlight is that melanoma in Indian patients may not always appear in the ways people commonly expect. In many cases, it can present in less recognized areas, which often makes early detection more challenging and delayed in timely treatment. So, in today's conversation, that takes the discussion a step further, where we are going to talk about the hidden realities of melanoma in India, delayed diagnosis, access gap, rural challenges, timely advancements, and why recognizing suspicious signs early can make all the difference. And joining us for the important conversation is Dr. Prabhat Bhargava, Professor in Department of Medical Oncology at Tata Memorial Hospital, Mumbai, one of India's leading institution in cancer care and research. So with the years of experience in oncology and multidisciplinary cancer management, Dr. Bhargava has been closely involved in advancing cancer care and improving patient outcomes. Thank you so much for joining, sir.
Thank you. Thank you for this warm welcome. Glad to be here.
Thank you so much, sir. And I'm really looking forward to this conversation to know more about melanoma care and how we can, create more awareness around this much talked disease.
So it is a rare disease, but glad that you chose this topic. Otherwise, everybody keeps on talking about common cancers, which awareness is now coming up in urban areas, but rare cancers like melanoma still has less awareness in Indian scenario. So, but rare doesn't mean no. So it is not absent in an Indian scenario. It is still present, and awareness of simple melanoma is very easy. And by having such things will raise awareness among our population.
Definitely so. So, as I've learned through the awareness, or let's say bit of interactions regarding melanoma. So melanoma in India can look very different from what we see in Western countries. So from your experience, do different regions or population in India see melanoma differently?
Yes, I totally agree that melanoma, what we see in Indian scenario, is way different than what has been described in textbooks. Textbooks most commonly describe melanoma in sun-exposed areas, so where sunbathing is more common, and that is why UV exposure leads to those melanoma. In Indian scenario, sunbathing is not that common. We already are in a warm climate, so sunbathing is not common practice. But that is why melanoma is rare, and we have uncommon types of melanoma which are not directly related to UV exposure, like mucosal melanoma in oral cavity or in the anal canal is very frequently that we see, or in the acral melanoma is very common. So this is more common in Indian scenario rather than the typical skin melanoma described in the West.
So as you have highlighted the difference very well, coming back to the rural population, many people think that melanoma is mainly a big city disease, because that is where it gets diagnosed. But could there be actually many people or patients in smaller towns and rural India who never reaches the specialist to get it diagnosed on time?
That is very common in any cancer. That in rural areas, still the awareness is not there, or the patient they are not willing to come to the city for diagnosis, and there are not adequate facilities to diagnose a cancer or any illness that they have, or they visit quacks many a time. Still, in many rural places, quack practice is very common, where it is being the skin changes would be suggest as thought of as just a skin infection and would be neglected for many days or many years onwards. And in fact, if I put my logic that UV exposure causes, so in rural India still there is more or more number of farmers,
Yeah.
where there will be UV exposure as they are working in field for a long period of time. So there should be more melanoma compared to what is seen in urban India, where we are sitting in AC environment and enclosed rooms. So would be there, but yes, it is underdiagnosed because of the lack of facilities and awareness among patients and the local caregivers over there.
So when we talk about the sun exposure and the UV rays, so in such cases, does sunscreen also protect us in?
To some extent, yes.
Okay, so it is one of the important
Yes,
part
that
of.
is why. That is why it can if you are deliberately going into sun, then try and put a sunscreen is what protects. SPF 40, 30 and above are known to cause, and are not known to cause, but yes, they can decrease the chances of cancers.
Thank you so much, sir, for highlighting that, because I don't believe that many people relate skin sunscreen to cancer protection and etc. I believe it's mostly till tanning and something like that.
So anything under the sun, including the sun, can cause cancer is what we say when patient asks why did I get cancer. So this is my say to them that there is no particular cause, and anything including the sun, under the sun, including the sun, can cause cancer.
So, over the years, in your experience, have you noticed the changes in that who is getting melanoma in India? I mean, the types of patients which come to you, whether it is younger patients or different professions, or the newer regions reporting more cases of melanoma.
Our population pyramid is such that more number of population is in the mid range, 20 to 40 years of age, and that is why at Tata Hospital we are commonly seeing when we analyze our and that how which patients burden did we see last year or in past 5 years, we commonly see that we see younger patients.
Okay.
This is partly attributed to the fact that in India, in population pyramid has more younger, approx 40 years of age is the more burden in our scenario. That is why we see younger patients more compared to what 50 years old or 60 years old is more common in US or in Western region. Compared to that, we see more common in 40 years of age. The ratio wise, because of the fact of the ratio is the population pyramid is skewed, and that is why we see more number of patients in 40 years of age approximately. Yes, but in other countries, as in other countries, more commonly in the age, as age increases, that itself is a risk factor. But yes, we see more approx 40 years of age.
So, as we are seeing that people of more than okay, between 20 to 40 are getting more of such type of cancer, and we also spoke about the sun exposure. So when we talk about the Western countries, I think it is their mainly activity involves sunbathing or going to beaches, etc. And when we talk about our Indian population, let's say the signs and symptoms, it is mucosal, like you mentioned, nail bed or acral areas. I think most of these are not much exposed to sun. Then why is that difference?
So we don't still don't know what is the etiology of mucosal melanoma. Etiology meaning what is causing those in mucosal melanomas. So that is anybody's guess why are younger people getting those cancers. Hardly melanoma is genetic. Otherwise, for when we say that younger patients are being diagnosed with a particular cancer, we think whether it is genetic. In melanoma, hardly there is any genetic risk factors which is known to cause more incidences in younger population.
So, we spoke about the different types of patients, and now how it appears on different types of patients which comes to you. So, in this episodes, we have learned that melanoma is described as master of disguise because it often looks like something harmless, but yet it is still there. So, from your experience, what are some of the most common conditions melanoma get mistaken of?
This is totally relatable, and patients come to us after 2 3 years that there was something in their palm which they had excised, and then everything was okay. Suddenly, something again came back, so they thought it is after excision it was never sent to lab, and they come years later again with a relapse. And by the time it is late, obviously. So we should be aware that anything which is there in our body but is changing its size, shape, if even if I have a mole since years since birth, but if it is changing its size, shape, or it is bleeding, or it is non-healing over a period of time, then we should think that it could be malignancy. So differential that normally what people said, I was told that it is an infection or it is a callus, because callus also occurs in as palms and soles in areas of weight bearing. So those are quite a differential because of which cancer gets misdiagnosed and neglected by local doctors.
So I think these are the signs which a
You should
person should not
not neglect. Yes.
So like we just spoke about that many people ignore the signs and mistaken of that this could be of something else. So there's nothing harmful and they do obviously do not think about big like cancer. So because of that it may delay to screening diagnosis and then yes, for the treatment as well. So delay in seeking medical help because they assume it could be just a normal dark patch or a nail color changing, swelling, bleeding, or something not so serious. So, how important is to, trust those early warning signs and get it checked on right time?
So obviously, in Tata Memorial itself, we say that early diagnosis lead. That means more chances of cure. So if we are able to identify cancer, we commonly say in stages: stage one, stage two, stage three, stage four. Depends upon the burden of disease in patient's body. So if there is less burden of disease, even I need to act less compared to if a patient has more amount of disease in his or her body. Even I will have to use more modalities of treatment or prolonged treatment. So that really has implication on patient as caregiver also and patient's economical status also. That is stage one can just get cured with 90% of patient can get cured just with surgery alone. But as soon as stage two or three or beyond comes, then I need to act surgery, chemotherapy, in some cases immunotherapy, or in some cases radiotherapy. In stage four, again, surgery has some limited role and immunotherapy role comes more. But then economic burdens and follow up and the chances of getting cured gets decreases. So getting diagnosis early will definitely lead to more number of patients getting cured at minimal expenses or minimal efforts required from patient and caregiver's perspective. Both are required
And that leads to better treatment out.
and better treatment out.
So the treatment options you just mentioned right now, um, and we also discussed about the early diagnosis. So can how early diagnosis can completely change the melanoma outcomes, and how different is the treatment journey between early stage and late stage melanoma? If you could, help our audience understand about this.
So I just said that for stage one only surgery is required and nothing else. Even then, surgery can be just simple, but a good surgery by a good surgeon is required. And 90% of patients outcome will never have the cancer back. So nothing else is required. But if it enters into stage 2, then after surgery, 1 year of immunotherapy is also required, but or some other targeted therapy is also required, but that becomes a cost affair and requires every 2 to 3 visit for a year. So that has its implication in terms of cost and social support. Some caregiver will also have to take leave and come for a year for treatment itself, and later on follow up will start in every all of them. And in for stage 3, then immunotherapy has more bigger role, that with surgery alone less than 50% will get cured. If I add immunotherapy, then yes, again chances of cure reaches 70% or even beyond. And stage 4, role of surgery decreases, and immunotherapy or targeted therapy, role of targeted therapy or immunotherapy comes into a bigger picture. And the outcome is roughly one third of patients will only have a long term, will be alive after 5 years, and majority patients may not survive beyond 5 years. So that becomes a great challenge in stage 4 patients. If patient comes to us in stage 4, then it's better if we diagnose early and we can have good treatment early. With less amount of treatment and pain, things can get better for patients.
Definitely. So I think that's how the early screening helps us to diagnose it on time, and then we have better treatment plan for them, and they can have a longer life and a healthier life to live ahead. Yes. So as we're just talking about treatment, and you mentioned about immunotherapy. So treatments like immunotherapy have transformed the melanoma care globally. But how different is the reality of melanoma living close to a major cancer center like Tata Memorial Hospital compared to a patient coming from smaller city or a rural district? What difference do you see?
The difference is in two perspective. As if somebody is staying nearby, as I said, the treatment goes on for a prolonged period of time. So staying nearby can visit easily for every 2 to 3 weeks and take the regular treatment and good follow up even after completing the treatment. But awareness among a patient who is coming from rural India is less. So they feel that surgery is done. That's it. I am already cured. Why is the doctor giving immunotherapy? So that understanding level and accessibility coming from rural area which is far off from Tata Hospital, or there wherever patient wants to take treatment, that also hinders their fact that there are high chances of default, that patient will not take it regularly because of the XYZ reason, that they will need somebody else also to travel with them, some family member, was also a challenge. And awareness that I already surgery is done. Why? So people definitely think this is a common myth in India. If surgery is already done, successful surgery, then why to take immunotherapy, adjuvant therapy for any cancer in general? Here, immunotherapy has more bigger role in melanoma, and that is why immunotherapy is coming from my mouth again and again, rather than other chemotherapy drug. So that awareness and accessibility definitely takes, and obviously rural India has less amount of economic factors also come into picture. When we ask that why did you default and patient doesn't answer, so many a times the reason is that financial burden is also there. So if it is later stages of treatment, then more and more financial burden comes. And when we explain that with this cost you will get that much outcome, so that itself leads to less enthusiasm among the caregiver. If I say 90% can get cured, obviously any caregiver will run behind that patient and try and get cured. But if I say yes, one third will only survive long term, then enthusiasm among the relatives also decreases. So chances of default increases. And again, that becomes leads to a dismal outcome. When we access our own data, what if in last 5 years, what have we treated compared to what a Western world treats, we will see that they have early diagnosis, and that is why their outcomes are better. Their more number of patients are surviving. We are also giving the same treatment now at par what Western world will give. But yes, if we have patients who have at advanced stages, then obviously their outcomes would be less compared to what a Western world is treating. Because of the referral bias that I am Tata Hospital, I get more patients who are at advanced stages, who come with hope, and so that they get some better treatment. But and that is why we face more challenge, that patients are from outpatient. Majority of patients are outside Bombay, and that becomes a challenge to continue the treatment over a prolonged period.
So, roughly to get an idea, if you could help us understand the statistics of melanoma cancer cases in our country, or on average basis, Tata Memorial Hospital sees.
It is a rare cancer in India, as we discussed. So, in spite of tertiary care centers where all referral cases come, in a month we see 5 to 10 cases on an average in a month, is what we will say.
And majorly they are in advanced stage.
And it depends on all stages. We see patients in all stages, yes, but majority of them would be in advanced stages.
Mm. So they expect that even if it is an advanced stage, to get it 100%.
Yes, obviously, that is the expectation with which they come to us, that it should get it. Hopefully, that it will get cured.
And I think that's what every patient thinks of, that uh, okay, we have this, but ultimately we'll go to a specialist, and we'll, with the proper treatment plan, this will help us to.
I have seen a patient who was sitting with a diagnosis, and supposedly today is XYZ date. That patient came exactly a year and 1 day later to me. And I thought that biopsy report is wrong. It is saying 2025, and by mistake, it should be 2026. And patient said, no, the day I got the report and I was waiting to reach Tata Hospital with a biopsy report for a year, my heart just sank. That how is that possible? I thought that is an error. And fortunately, that patient came 1 year and 1 day later. I really thought it's a typing error. 25, somebody has written 25. It should be 26. He said, no, no, report is 1 year. And what the treatment did you say? No, I want to go to Tata, and I was sitting with that report. It's really heart breaking it was. How can that happen? But yes.
So in that 1 year, how much the melanoma progressed?
Obviously, when he reached, it was a stage 4 disease.
Okay.
But when you say that stage 4 will not survive beyond a year,
Yes.
and you are seeing this patient, at what stage it would have been diagnosed, nobody knows, because as soon as diagnosis came, he was waiting to reach hospital, but arranging funds or arranging relatives or logistics. So I have started, as a doctor, you get angry when patient doesn't obey or follow your what you have said, and you know that that would have really been in favor. So sometimes patient feel, why is doctor getting angry? But even we have that emotional connect. That why didn't you come on 20th itself? If you would have reached on that day, things would have gotten better. But when patient says something like this, then later on you will not shout at any other patient that they don't give you exact reason why did they default. And there are many reasons for getting default.
And I think they have their own reasons. Other is they don't take their health on priority. That delays the diagnosis and the treatment plan. And like you just mentioned, a real case. I think I can I cannot completely understand, but I can feel that experience and that emotion from the way you're telling me. That it's
The
very
immediate was to call my social worker. This patient's everything should be done in a week. Let me know wherever he gets stuck. If a patient has already waited for a year, but
That's
I knew it will come out to be stage 4 if he was waiting for a year. But
that's the best a doctor can do, sir.
yes,
So, like you just mentioned about a patient's story. So, melanoma treatment is today far more than hopeful, I believe, than it was a decade ago. So, from your perspective, what advancements, research, new, invention of technology have seen and that has changed the patient outcomes the most?
so in general, I will say when my teacher was teaching around 7-10 years back, that as soon as they used to see a stage 4 cancer, they when he was getting taught, he and this famous quote, I when he started our class, he was saying this, that nobody taught him how to manage cancer, a stage 4 cancer, because when he was a student, stage 4 cancer go home, and now I just said that stage 4 cancer 1/3 will be long term survivor. So that is how drastically treatment of cancer has increased compared to what when he would have been a student, to now that he was teaching what he learned on his own. That is how he started his class, and that makes us realize the value of treatment that we have today. If 1/3 of patients can be survived, that is all because of magic of immunotherapy, which has come into picture. Especially melanoma is very chemosensitive, and very few cancers are immunotherapy so sensitive. Among them, the poster child would be melanoma, where just immunotherapy alone, nothing else, even in stage 4 cancer, is required. Just immunotherapy, but repeatedly for approx 2 years. If patient is able to afford it on logistic, as we discussed, then 1/3 of patients, out of 3 patients, 1 patient you will see even after 5 years.
That's how effective.
That's how effective it is. Otherwise, the prognosis is so dismal that if no treatment is done or immunotherapy is not possible, which is not possible even till date with most of the patients, we published from Tata Hospital roughly 5 years back that patients who deserve immunotherapy, only 1.6% of our population were able to take. That was 5 years back. Accessibility has definitely improved. Feasibility has improved because of many reasons. but that is how dismal it was. So costly it was. It used to cost 50 lakh rupees for a year. So obviously 1.56% only could take it. Now, obviously, approx 5% of patient or 10% of patient can take it. And innovations have come that we have proven that instead of full dose, if we give 1/20th of the dose or 1/10th of the dose, that is also equally effective.
Okay.
At least at least equally effective is the word what I would say for a layman person, that if full dose is not feasible, at least take 1/10th of the dose of what the full dose is. And if it is a luck game, if you are that one third lucky, then you with that one third dose or 1/10th dose also you may be that lucky person. It is difficult to prove in melanoma that really whether 1/10th would be equally effective, because it is a rare cancer. So to find equal number of patients to prove that non-inferiority is difficult. But we have proven in head and neck scenario from Tata Hospital that in head and neck cancer patient, if full dose instead of full dose, lower dose was given, it is also effective. So who cannot afford anything, some 1/10th of the dose is also possible.
I think that's how the effect of immunotherapy is in terms of melanoma cancer patients, or let's say you just mentioned about head and neck cancer patient also.
Yes.
So the hero here is the immunotherapy.
Yes, agreed. In head and neck, lung, and melanoma, it has done really wonders for patients' treatment.
So as the treatment journey is a long process, and people come for the follow-ups, and then whatever the treatment plan is planned, so many families feel the journey ends once the surgery or treatment is over. But what do patients often not realize regarding the follow-up care, reoccurrence risk, and long-term monitoring in melanoma care, in your experience of you have learned from the types of patients which have come?
As I said, more awareness, patients who have more awareness, they also get busy once surgery is done into their regular life. And once surgery is done, most of the patients feel that surgery is done, that means I have achieved cure. But there are chances of cancer coming back. Whatever was visible to the naked eye, that surgeon has removed. But whatever is invisible, that may be lingering around, and that is the cause that many patients get cancer back. So to remove that, what is not seen, surgeon cannot do that. And that is why we have to give some medicine or the other, which will take care and remove the remaining thing. And that is why equally important is to give some adjuvant, with what we call as adjuvant treatment, is to be given after the main hero surgery. Adjuvant is side actor, maybe you can say, is what that is how the word would have come. Adjuvant treatment is equally important. Later on, trials have shown that if we give new adjuvant, that is even before surgery, in melanoma, immunotherapy is more effective.
Okay.
Because when immunotherapy recognizes your cancer cells as foreign body and go and kill them. But if surgery is done, then foreign body is very less left. So it was hypothesized that even giving before surgery would do more wonders, and it has been proven now. So in fact, if patient has a stage 3 disease, immunotherapy is given first, and then roughly 50% will have such a brilliant response that during surgery very negligible amount of cancer will be left, and they don't need anything further.
Okay.
50% will have almost negligible amount of cancer left just with 2 doses of immunotherapy. And if I do surgery upfront, then I need to give 1 year of immunotherapy.
Okay,
So
that's the difference.
that's the difference. That 2 doses can do, if you are that lucky person, in 50%, then you don't need further. If you are not that lucky, then we need to give you for whole 1 year.
So, we have discussed about the screening process, the how it presents differently in different regions of our country, or let's say the Western countries and India, and then diagnosis and how the treatment plan can change entirely if it is diagnosed on time. As we are going ahead with the conversation, what would be that one message you would like to give to every family doctor, dermatologist, surgeon, frontline healthcare worker in our country regarding the suspicious lesion or unusual symptom, to be take care of or to be aware of?
For melanoma in particular, it is better if any lesion is changing its. If I have a lesion for many years, and if it is changing its shape, size, or it started bleeding, or it is changing its color, then be suspicious and biopsy it. Not just scrape it. Just do a good excision biopsy. then and biopsy does not is more important than rather than neglecting it. And if for 7 days of antibiotic or something you can try, but if later on also it is increasing and not resolving in spite of the initial suspicion diagnosis, alternative diagnosis, then it's better to have a biopsy.
Because I believe not.
I sit in a hospital. I feel why were you diagnosed late? But I agree with that. A local doctor would be seeing 100 other causes and one cancer. So they cannot have a suspicion of cancer for everything.
Correct.
When I see only cancer, I feel why was it not? The doctor did not have suspicion before that it could be cancer. But if a local doctor, immediately says it could be cancer, patient will get scared and will never visit any other doctor. So they are also right. If for 1 week or so they can think of many other alternative diagnoses, 1 week or 2 weeks, and see if it is resolving. But if it is not and there are warning signs, then better to have a excision biopsy.
So why I specifically asked that question regarding the healthcare workers is because many of the time the frontline workers are also not aware that it could be a sign of cancer. And the another reason you mentioned is they cannot point it out cancer for every
For every-
problem. Yeah. So I think that awareness is still
So that
required.
bias is there when I'm sitting in a cancer hospital. Why are people not thinking as cancer? But I agree, a local doctor is seeing hundreds of cases and then one cancer. So thinking for all 100 as cancer would be really wrong.
Disaster.
Disastrous, yes. Equally disastrous.
So, as we are moving ahead with the conversation, I have another fun segment which is called Mythbusters. So, I have few statements which could be myth or fact. You have to help us understand whether it is myth or fact, and then give us a statement as well. People with darker skin don't get melanoma. Myth or fact?
It's a myth. Everybody can get cancer. Yes, it is rarer in black person with black skin compared to what a fairer skin person get. But yes, even black skin, especially when we are talking in India that palms, acral melanoma is common or mucosal melanoma is common. Yes, even skin melanoma is can be there in a dark skin person.
Okay. So, melanoma only affects skin exposed to sunlight. Myth or fact?
Myth.
Myth.
It can occur anywhere, especially below the nail bed. Subungual melanoma or mucosal melanoma has no relation with sun.
Sun exposure, yeah. So if a spot is painless, it cannot be dangerous.
No, cancer can be equally be painless in many patients, and need not. Cancer pain is the worst pain, and that is why people feel that pain nahi hai to cancer nahi hai.
Yeah.
But it is not the fact. Cancer can be painless also.
So they should be aware and vigilant regarding
Yes.
every sign.
Yes.
Biopsy can spread melanoma.
No, I need some proof before saying anything as A or B. So biopsy is the most important thing that I will do before saying that you have a melanoma or anything. And so biopsy does not spread cancer. A good excisional biopsy does not spread cancer.
Okay. So melanoma is too rare in India to worry about.
For that particular, I agree partially, but for that particular person who gets cancer, it can be life changing. So worry about, everybody should be worried. And the way as we spoke about that even 40 years are getting cancer.
Correct.
And in newspaper we are seeing that suddenly a 40-year was dancing and had a sudden cardiac arrest. So the way lifestyle is going, anybody can get cancer. So everybody should be worried for cardiac illness or a cancer anytime in life.
I think it is a quite fast evolving world in which we are living. So
anything can happen at any age is what we are seeing these days.
So that was our myth versus a fact kind of a segment. Now we have another fun segment which is rapid fire. So I'll be asking some fun rapid question and expect some fiery answers. So one melanoma symptoms Indians ignored the most.
Any swelling in the soul is what I would say more. Soul is neglected most of the times, and we should examine our soul equally. Acral melanoma is more, and mucosal melanoma is more common. So changes in mouth or soles and palms should be not be ignored.
Okay. One body area where melanoma commonly hides in Indian patients.
Below the nail bed and below the sole again would be the answer. That hardly even I examine my soul, so we should be careful. Yes.
The biggest reason melanoma gets diagnosed late in India.
Most of the reason is because we don't think that it could be cancer, for any cancer in particular, and especially melanoma, that it is rare, so it cannot be. So even local doctor also will not feel that it can be a melanoma. because of the fact that they see 100 other reasons more, and melanoma is so rare.
Correct. So because of its rarity, no one believes that it could be
That it can be a melanoma.
One suspicion lesion should reach early to a specialist.
So anything which is changing color, bleeding, not healing over past 1 week or so, increasing in size, so that should be suspicious, and patient should visit local doctor, or if it is still not healing after treatment, then an excision biopsy.
So one word for melanoma awareness in India today.
That it is rare in India but not absent in India.
Okay. So I think that's the most powerful crisp line which we need to understand, that it could be rare in India but not absent. So
in Indians.
In Indians specifically, yes. So with that, we have come to end of our discussion and conversation. Thank you so much for sharing those insights, your expertise, how patients come to you, how do you deal with, and what type of cases normally comes to you, and basically giving us the actual picture of melanoma in our country.
Thank you. My pleasure. Even I enjoyed the session.
Thank you so much, sir. I think one of the strongest takeaway from today's conversation is that melanoma may often be overlooked in India, but the signs are there, and recognizing them early can genuinely save lives. So whether it is an unusual mole, a nail discoloration, or non-healing lesion, or a suspicious patch that simply does not feel normal, awareness, attention, and timely medical consultation can make all the difference. And that is exactly why conversation like this is important, to encourage earlier action, reduce delay in diagnosis, and build stronger awareness around melanoma across India. Thank you, everyone who joined us for this episode, Spot the Sign. So, what we aim is to stay aware, stay observant, and most importantly, if you spot the sign, do not ignore it and see a specialist. Thank you.